Omicron COVID Information and Action Plan. Omicron is a new type of COVID-19. It is now very common in Australia. More research and data is still needed to understand Omicron, but early reports suggest that Omicron spreads faster than the previous types of COVID virus. Omicron can reinfect those who have had COVID-19. Victoria is experiencing high Omicron case numbers. More data is required to understand whether Omicron causes illness as severe as the previous variants. But at this stage, not as many people are needing to go to the hospital. Research indicates that a booster shot of the Pfizer or Moderna vaccine is expected to protect against severe illness, hospitalization, and death due to infection with the Omicron variant. To protect yourself and your family, you must wear a face mask indoors, except at home. It is strongly recommended that you wear a face mask outdoors if you can physically distance or if you are with people who may be vulnerable to COVID-19. Carry a mask when leaving home. Get your next COVID-19 vaccine dose as soon as you are eligible. This is 4 months after your second dose. Omicron COVID is spreading quickly, so if you have any of the symptoms below, you must get tested and isolate. Do not assume you have a cold. The symptoms to watch out for are fever, chills or sweats, cough, sore throat, shortness of breath, runny nose, loss or change in sense of smell or taste, headache, achy, stuffy nose, nausea, vomiting, diarrhea. Very important information. Testing rules have changed. If you test positive on rapid antigen test, you are considered COVID positive and you do not need a PCR test. You must report your positive rapid antigen test result as soon as possible. To report your result in another language or if you need any assistance reporting your result, call the coronavirus hotline at 1-800-675-398. Press 0 for translator. Or you can report your positive result online. COVID-19 positive rapid antigen test self-reporting form. dhvic.gov.au.powerappsportals.com/rapid antigen test. Rapid antigen tests are currently hard to find. The government tells us they are coming soon. We will tell you when and where you can get them when they are in stock. If you have symptoms, you can still get a PCR test at Bowen Health and isolate until you get result. If you test positive for COVID, you must immediately isolate for 7 days. If you are living with others, isolate away from them as much as possible. Your household will need to get tested and isolate for 7 days. Support is available to help you and your family, including food and financial assistance. Call 1-800-675-398 and press 0 for an interpreter. If you have tested positive using a rapid antigen test, you must register so you can receive financial support and receive a medical certificate if you need one. Who you should tell. Household contacts. You must tell your household and household-like contacts you have tested positive for COVID-19. They are people you have spent more than 4 hours with within a house, care facility, or accommodation. They must get tested on day 1 of their isolation period or as soon as possible with a PCR test if they have symptoms or a rapid antigen test if they do not have symptoms. For more information about the test, look at the next video that we will share. They must get tested again on day 6 of the isolation period. They must get tested again on day 6 of their isolation period with a PCR test if they have developed symptoms, or rapid antigen test if they do not have symptoms or tested negative from the first PCR test. They can leave isolation on day 7 if they received a negative result from this test. If they get symptoms at any time during isolation, they must get a PCR test. If they test positive on any rapid antigen test, they must get a PCR test. Social contacts. Advise your social contacts, your family members, friends, and relatives. They must get tested if they have symptoms and isolate until they get a result. Your social contacts are people with who you have had 50 minutes of face-to-face contact or spent 2 hours in the same indoor space. Your social contacts are not people from your home, your workplace, or school. Tell your workplace and/or education facility. If you worked on site while infectious, you must tell your employer or workplace you have tested positive to COVID-19. Your employer or workplace will tell other staff who are workplace contacts that they must get a PCR test if they have symptoms and strongly recommend using a daily rapid antigen test for 5 days if they do not have symptoms. Tell your workplace and/or education facility. If you worked on site while infectious, you must tell your employer or workplace you have tested positive to COVID-19. Your employer or workplace will tell other staff who are workplace contacts that they must get a PCR test if they have symptoms and strongly recommend using a daily rapid antigen test for 5 days if they do not have symptoms. If you or your child attended an education facility, school, childcare, or early childhood while infectious, you must tell the education facility you have tested positive for COVID-19. The education facility will tell other students and staff who are education contacts that they must get a PCR test if they have symptoms and strongly recommended using a daily rapid antigen test for 5 days if they do not have symptoms. Isolate and look after your health. If you have mild symptoms, such as runny nose, sore throat, aches and pains, dry cough, tired, headache, change in taste and smell, change in appetite, feeling sick, what to do? Rest, drink plenty of water, eat small regular snacks and take Panadol if needed. If your symptoms get worse, such as shortness of breath, coughing up mucus regularly, vomiting or diarrhea, minimal urination, you should call GP or call the 24-hour nurse on call by calling the interpreting service on 131450 and asking for nurse on call, or call 1300606024, then tell them what language you need. If you have severe symptoms, such as shortness of breath when you are sitting still, chest pain, coughing up blood, blue lips, fainting or feeling like fainting often, or confused and can't look after yourself, call 000 for an ambulance. Remember, ambulance is free if you have Centrelink, healthcare, or pensioner concession card.